Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Zia. I warmly welcome all of you from platform of MMK to the presentation on career counseling and exam guidance for medical graduates as a part of education initiative of MMK. Today we will be discussing about the challenges faced by the medical graduates, their solution and available options. The time medical graduates clears final exams, he is facing so many queries like what to do, what are different medical lessons in examinations and their eligibility criteria and preparation methods. What specialty to be chosen if he or she want to become a specialist, and then how to proceed. First of all, we need to do our self-assessment. Every person is unique and has his or her own personal scenario and canvas of life, which is affected by domestic issues, socio-economic conditions, and personal commitment. So, our decision for the future options should be realistic, implementable, and matches with our circumstances. Road to success is not dependent on the field chosen, but on our hard work, commitment, and sustained efforts. In summary, we have to avoid 5 C's: compare, complain, curse, try, and criticize. And most important for all of us to follow is never compare ourselves with the others. Career planning. As part of career planning, you should know your values, learn about yourself, identify your skills, research the career options, then link your major and your career. Medical licensing examination for the different countries. For Pakistan, NLE exam, NLE stands for National Licensing Examination. For USA, USMLE. For UK, PLAB. For Australia, AMC exam. For Canada, MCCQE exam. For UAE, MOH exam. And for Saudi Arabia, SLE exam is undertaken. National Licensing Examination (NLE) gauge ability of MBBS graduates' competence to practice independently. This exam consists of 2 portions. First is the theory examination and second is the skill-based clinical component. Clinical skill examination, abbreviated as CSE. Theory and clinical skill examination are mandatory for full license to practice as general practitioner in Pakistan. Theory examination consists of applied basic sciences and applied clinical sciences. Applied basic sciences has total 60 MCQs, which are further divided into applied pathology, applied anatomy, applied physiology, clinical pharmacology, applied biochemistry, community medicine, forensic medicine, and toxicology. Applied clinical sciences has 140 MCQs, which consist of medicine and allied, surgery and allied, obs and gynae, pediatrics, eye and ENT. And total of the MCQs number is 200. Second is the clinical skill examination. It has total 20 stations, which are further subdivided into medicine and allied 7 stations, surgery and allied 7 stations, obs and gynae 2 stations, pediatrics 2 stations, and both eye and ENT 1 station each. One important point to note here is that medicine allied, surgery allied, and obs and gynae, these 3 has 1 station which is mandatory for the student to pass. Passing the theory MCQ component of NLE exam remains valid for 5 years from the date of passing the theory component. CSE component must be passed within 5 years of passing the theory component of NLE. If a candidate fails the CSE in 3 consecutive attempts, she or he must reappear in both the theory and CSE components of the NLE. That That is, after every 3 failed attempts at CSE, candidate will have to retake the entire NLE exam. For more information, you can visit Pakistan Medical Commission website address as shown here. USMLE. USMLE stands for the United States Medical Licensing Examination. It is a registration exam to practice in the United States of America. This program helps development, delivery and continual improvement of the high quality assessment across the continuum of physician preparation for the practice. It has 3 components which are named as Step 1, Step 2 and Step 3. Step 1 examination assesses the concept of basic sciences with special emphasis on the principles and mechanism underlying the health, disease and modes of therapy. It is a one-day examination which is divided into 7 60-minute slots and administered in one 8-hour testing session. Step 2, clinical knowledge, assesses an examinee's ability to apply the medical knowledge, skills and understanding of clinical sciences. It's also a one-day examination which is divided into 8 60-minute blocks and administered in 1 hour testing session. USMLE Step 3, it assesses whether you can apply the medical knowledge and understanding of biomedical and clinical science essential for the unsupervised practice of medicine, which emphasizes on patients' management in ambulatory settings. For more information regarding USMLE, these are some useful website address which you can visit. PLAB examination. PLAB stands for Professional and Linguistic Assessment Board Test. It is a registration exam to practice medicine in the United Kingdom. There are 2 parts of the PLAB test, PLAB 1 and PLAB 2. PLAB 1 is the written examination made up of 180 multiple choice questions which you must answer within 3 hours time period. While the PLAB 2 is an objective structured clinical examination which is known as OSCE. OSCE stands for On-Station Clinical Examination. It's made up of 18 scenarios, each lasting 8 minutes and aims to reflect the real life settings including a ward consultation or an acute ward. For more information regarding PLAB, you can visit these some useful website addresses. AMC examination for the Australia. They consist of a computer adaptive CAT test which is a MCQ examination, and the second part is either a candidate has undergone AMC clinical examination or workplace based assessment which is called as WBA program. The AMC workplace based assessment, before applying for a WBA program directly to our WBA provider, you must have passed the AMC CAT MCQ examination and granted registration by the Medical Board of Australia in order to be employed in an approved clinical position for workplace based assessment program. The AMC Computer Adaptive Test, CAT test, it is a fully integrated multiple choice question examination delivered in one 3.5 hour session in examination centers worldwide. The examination consists of 150 A-type MCQs which has a 1 correct response from 5 options. It focuses on essential medical knowledge involving the understanding of the disease process, clinical examination and diagnosis, and investigation, therapy and management of the patient. AMC clinical examination is an integrated multidisciplinary structured clinical assessment exam. The examination comprises of 16 stations and 4 rest stations. It is administered either online via video conferencing format at a location organized by the candidate or when the health restrictions allows at the National Test Centre in the Melbourne, Australia. MCCQE. It stands for Medical Council of Canada Qualifying Examination. It has three components: MCCQE1, NAC exam, and MCCQE2. MCCQE Part 1 is offered in Canada and internationally in over 80 countries through Prometric up to 5 times a year. As a medical student, you can take this examination during the final year of your medical school, but your medical school must be recognized by the Committee on the Accreditation of Canadian Medical School or the Liaison Committee on the Medical Education in the US, or your school can be identified by the Canada Sponsor Note in the World Directory of Medical School. Only then you can appear in this MCCQE exam during the final year of your medical school. Second component is National Assessment Collaboration Examination, abbreviated as NAC exam. It is a one-day exam that assesses your readiness to enter a Canadian residency program. It is an objective structured clinical examination. For a given administration, all candidates rotate through the same series of stations. Each station is 11 minutes long with 2 minutes between the stations. When you qualify the NAC exam, then you are eligible to enter into the Canadian residency program. MCCQE2. This is an exam which must be successfully completed to ensure the licensing in the full class for independent clinical practice in the Canada. Over a 2 days period for a total of 3.5 hours, this exam assesses the clinical competency through a series of clinical simulation stations. Before taking this exam, you must have passed MCCQE1 and completed at least 12 months of clinical training in Canadian residency program. Next is the MOH, DHA and HOD examinations. What is the difference between these exams? DHA licensing examination is a permit from Dubai Health Authority which gives you permission to practice in Dubai. HOD licensing examination is a permit to provide the professional healthcare in Abu Dhabi, while the MOH licensing examination gives you permit to work in the medical field in other 5 Emirate states, which include the Sharjah, Ajman, Al Quwain, Ras Al Khaimah and Fujairah. MOH exam is a standardized exam for the licensure of the healthcare professional in UAE. This exam is administered by the Ministry of Health, which oversees the medical practitioner professional licensure and is responsible for implementing healthcare policies in all aspects under the UAE. How can I register for the MOH exam? The first step is MOH Professional Credentialing Evaluation phase. It is an initial document screening and determining if the candidate is qualified. Then the step 2, which is the MOH Data Flow Application phase, which is also known as Primary Source Verification or PSV application phase. It is a highly dependable background screening approach that immediately verifies a candidate's personal or professional credentials from the source that issued them. Then the candidate has to enter into the step 3, which is the MOH exams scheduling phase. The pre-registration and confirmation of the candidate's MOH exam schedule are part of the MOH exam booking and scheduling stage. It consists of 3 parts: written examination, practical and viva. The written examination comes in the form of multiple choice questions. A candidate must pass the written to qualify the practical and the viva exams. Then the step 4 is the take the MOH exam, and step 5 is the claim your MOH exam results. Next is the Saudi Medical Licensure Examination, abbreviated as SMLE. It is an exam that assesses your readiness for practice and or to proceed to postgraduate training in Saudi Arabia. It consists of 300 MCQs of 6 hours total duration. It is divided into 3 sections of 100 questions each, with time allocation of 120 minutes for each part. These MCQs have 4 options from which the candidate will choose the one best answer. The examination shall contain rhetorical questions that test knowledge and questions with scenarios that test other skills. For example, interpretation, analysis, decision making, reasoning and problem solving in patient management. After candidate has achieved proper license to practice in the chosen locality and region, now he will proceed to the road to specialty. Now the question is, what specialty to be chosen? Road to specialty is a vast field having different options like fellowship programs, membership program, different kind of diplomas, master program, MPhil and doctorate programs. Fellowship programs. College of Physician and Surgeon Pakistan offers Fellow of College of Physician and Surgeon program, which is basically comprised of 2 parts, FCPS Part 1 and FCPS Part 2. FCPS Part 1 is an entrance exam for the training for the FCPS. It is an MCQ based exam that is held 4 times each year. It is a computer based exam with 2 parts of 100 MCQs each and total marks are 200. Exam of the medicine and allied, surgery and allied, eye, ENT and gynae are conducted simultaneously every session. FCPS Part 1 books and syllabus. The commonly followed books are First Aid USMLE, BRS Physiology, Snell Review Anatomy, BRS Pathology, Snell Embryology Review Book. Pharmacology, biochemistry and other subjects can be covered by the First Aid USMLE, which is enough for these subjects. For more information regarding syllabus and books, you can visit the CPSP website. Fellowship Program, FCPS Roadmap. After the completion of MBBS and house job, candidate appear in FCPS Part 1 exam, and on clearing the FCPS Part 1, he gets registration with the CPSP R&R department. CPSP offers fellowship training in 75 different specialties, and FCPS training varies from 4 to 5 years depending upon the specialties chosen. At the end of first 2 years of training, candidate is subjected to intermediary module examination, and after clearing that examination, he is eligible to appear in the FCPS final exam at the end of 4 or 5 years training. On completion of the first fellowship, candidate has an option to undergo the second fellowship program, for which he has to get registration with the CPSP R&R department and start training for 2 to 3 years depending upon the chosen specialty. And at the end of training, he has to appear in the FCPS exam, and on clearing that, he can get the second fellowship degree. Here is the list for the specialties for fellowship program, which is broadly subdivided into the basic sciences and the clinical sciences. And clinical sciences are mainly of medicine and allied specialties and the surgery and allied specialties. Membership programs. CPSP offering MCPS program. After clearing the MBBS and house job, candidate get registration with the CPSP R&R department for the required program of MCPS and undergo a 2-year training program. At the end of that program, he or she has to appear in the MCPS exam, and to clear it, he will get the MCPS diploma. CPSP offers membership training in 22 different specialties, and MCPS training is a 2-year training program. More than 19,000 training slots have been awarded in 207 CPSP accredited medical institutions throughout the country. CPSP capacity building short courses and workshops are mandatory, and prerequisite for appearing in the examination. These workshops include basic surgical skill, basic life support, research methodology, biostatistic and dissertation writing, communication skills, and introduction to computer and internet. Here is the list of the MCPS specialties available. You can have a look on this. Relatively simple and straightforward option for a medical graduate to become a specialist are the postgraduate diplomas. Postgraduate diplomas, there is a large number of list of diplomas available which are recognized from the Pakistan Medical Commission. Diplomas are mostly 2 years programs. For example, diploma in the medical jurisprudence, diploma in tuberculosis and chest diseases, in the cytological medicine, medical radiology, ophthalmic medicine and surgery, laryngology and otology, cardiology, child health, clinical pathology, diagnostic radiology, gynae and obs, anesthesia and reproductive techniques. CPSP recently launched a diploma in the health profession education named as MCPS HPE, which is a 2-year program, and eligibility is the medical and dental graduates with 1 year house job and minimum 2 years of teaching experience after graduation, or having worked in the Department of Medical Education for at least 1 year. Next is the master's program. Master program can be MD program, MS program, and the MDS programs. These are usually 4 to years program offered by the different universities recognized by the Pakistan Medical Commission. These are the different specialties in which the master's programs are available. Surgery and allied disciplines, then medicine and allied disciplines. Here is the list of the different specialties for which the candidate can opt for the master's program. And then for the faculty of the dentistry and allied specialties, MDS program is a 4 years program available in different specialties: operative dentistry, oral and maxillofacial surgery, orthodontics, periodontology, and prosthodontics. There are some other specialty options. For example, is the Masters of the Hospital Management, it's a 1 year program. Masters of the Maternal and Child Health, 1 year program. MPH, 1 year program. MSc Field Epidemiology, Masters in the Family Medicine, and Masters in the Health Professional Education. Apart from the master program, a candidate can opt for the MPhil or PhD program. These programs can be directly opted, or after the master's program, candidate can appear in the MPhil and PhD programs. There are different options, a large number of lists available in the different specialties, mainly the basic sciences and some of the clinical sciences. Now, after self-assessment and decision making about your future plans and sufficient information available regarding the different options, next question is how to proceed. Here is the step-laddered pattern to proceed. First of all, eligibility criteria fulfillment for that specific specialty, selection of the study material for that program, selection of the institutes offering target program, any coaching assistant available if needed to the candidate, and any available option for the practice test. MMK, Master of Medical Knowledge, is serving as a tower of light for the medical graduates and undergraduates. In the present era of literature, our system is flooded with books and online materials. Students at any level of their studies are wondering and striving for the knowledge and secure competitive mass. Many institutes are serving to solve this issue, but medical graduates up till now are deprived of any authentic option. A team of experienced, qualified, and enthusiastic young fellows from the platform of mmkhub.com dare to take the responsibility of providing the standard, updated, and state of art education services for the medical graduates. May Allah help and guide all of us. Assalamu alaikum. Thank you for your attention. If any question, you can ask